Dr. Benjamin Karlberg is an interventional radiologist and Meadville Medical Center 2025 Doctor of the Year. Doc, thanks so much for joining us.
Thanks for having me.
So many places to start, but let's go back a few years. Where did you grow up?
So I grew up in Johnstown, Pennsylvania, so not too far away. I did most of my training except for medical school in Pittsburgh, so somewhat local to the area. Still live in Wexford, but grew up in Western Pennsylvania. Went to college in Indiana, went to medical school at Drexel University in Philadelphia, and then again did my residency at Allegheny General and my fellowship at UPMC.
When did you know this is the path you wanted to take?
So actually in medical school during the first several rotations, I realized that I wasn't particularly interested in sort of the major fields of medicine and surgery, but I did a couple rotations in radiology and found that very interesting. And then actually during my surgery rotation, we went down to the interventional radiology suite and I saw some procedures down there that were very fascinating. And so that kind of piqued my interest somewhat early on in medical school and led me into radiology.
Talk about the interventional part. What is it? What should people know about it?
So an interventional radiologist is first a radiologist, so we have to go through the radiology residency, which is a 4-year program, and then we do a 1-year fellowship in interventional radiology. And the simplest way to put it is basically an interventional radiologist is a radiologist who does procedures using image guidance. So all types of procedures, a lot of biopsies using ultrasound guidance or CAT scan guidance. We'll do drainages using CAT scan guidance of abscesses in the abdomen or pelvis. But everything that we do is essentially image guided.
I would imagine the quality, the technology behind it has changed a lot over the years. Talk about from when you started to now, what has changed in your field?
So the image quality has been, pretty consistent. I've been out for almost 10 years now. So the major changes in image quality have really come in the field of ultrasound. So ultrasound has gotten much, much better, which gives us more detailed information, more detailed anatomy, and in real time helps us a lot. The CAT scan imaging has really been, very, very similar. So haven't been a whole lot of advances there. In terms of imaging, ultrasound is kind of the major field that's really improved a lot. My typical day is pretty varied. I do have scheduled cases, scheduled procedures. Most of those, if they're outpatient, are biopsies, bone marrow biopsies, thyroid biopsies, paracentesis where we drain fluid from the abdomen. Those types of procedures are all scheduled. But there's a lot of consultation that happens between the oncology department, between pulmonology department, looking at patients who've had CAT scans or MRIs or ultrasounds and asking, is this area of abnormality something that we can biopsy here? Is it appropriate? Is it safe to do that? So there's an awful lot of that that happens during my day. In between that, I do read cases. I interpret CAT scans, MRIs, X-rays, ultrasounds, that type of a thing. And then in terms of the things that I bring to Meadville Medical Center, over the last 10, 15 years, there's really been a significant uptick in the diagnostic radiology volume, which has made it very difficult for the radiologists who've been here to kind of keep up with procedures. And so I've been able to sort of help take some of that burden off of their shoulders. And in addition to that, we've also brought some new procedures to Meadville Medical Center that we weren't doing previously. Specifically vascular access, venous access, so we're doing port placement, do quite a bit of port placements for the oncology folks, hemodialysis catheter placements, we do bone marrow biopsies, which we haven't been doing, so we're able to do that in the hospital with conscious sedation and under image guidance, which is really a good situation for the patient. That's the way I would want to have a bone marrow biopsy if I needed to have that. So those are some of the main things that I've been able to do since we started, the hospital has been really great in providing the resources for us. We have 2 new cath lab rooms, which are rooms that I work in, and the second one was just completed last week, actually. So so they're definitely putting resources in, and the main goal really is to keep patients here in Meadville and to reduce the rate of transfer to Erie or Pittsburgh.
And I was just going to ask you about that. It seems like what you're able to provide is a savings of time where you're not sending something out, waiting for it, but you can handle it right here. And again, that plays into what you were talking about with that patient care. And that's just one more thing. Was that something that was attractive to you coming here, knowing that you could bring those services?
Yeah, definitely. I have a good friend who reads diagnostic radiology procedures or exams for Meadville Medical Center, and so I knew that there were some procedures that were being done here, but I knew that there were some pretty significant gaps, and so through my friendship, I was able to connect with Dr. Kraling, and he identified some of the need that was there, and so we had a conversation, and here I am.
Talk about what you see, your field getting into in the next 10 years. You've already talked about the past 10, but what's the future like?
Well, there's an awful lot just in terms of interventional radiology as far as interventional oncology procedures go. So right now there's quite a bit of treatment for liver tumors non-invasively or minimally invasively. So we basically use a catheter, go into the artery, get into the artery that supplies the tumor within the liver, and then deliver small particles or beads that are impregnated with chemotherapy. So we're giving sort of a local chemotherapy dose to liver tumors. So that's one major area that has been in place, but that's sort of evolving. Cryoablation is another procedure that has been around for quite a while, but I think the applications have been increasing, and that's where essentially you use either ultrasound or CAT scan guidance, and you put a small needle into a tumor. Oftentimes it's within the kidney, and we can put a small needle into the tumor and freeze the tumor and effectively kill the cells. And if it's under a certain size, typically about 3 centimeters, there's over a 94% effective rate of destroying the tumor without recurrence. So those are a few of the procedures that have been around for a while, but I think the applications continue to broaden.
Are patients surprised at the level of care that's offered here in rural Pennsylvania?
I think so, yeah. I think there are patients, certainly when we do bone marrow biopsies, I think that that's something that, again, had been done in the office, but some patients have been transferred out for that, and so I think they're surprised at the level of care and how easy the procedures really are, and how we're able to do them here. So yeah, I would say so. I've been here for a little over a year now, and so I think we've actually made some good inroads with physicians in terms of them referring patients to us, particularly on the inpatient side. But yeah, I mean, some of the things that I would highlight, certainly one of the things that we want to do more of would be treatment of gastrointestinal hemorrhage or bleeding. Patient comes into the emergency room, and they're having an issue with that, and we're actually able to treat that in a similar way that I mentioned with the interventional oncology, being able to treat tumors in the liver. We're able to actually stop bleeding it from the inside of the artery. So that's one of the things that we've tried to really push, because that's been a procedure that traditionally has just been transferred to Erie or to Pittsburgh. So that's definitely an area that we can help out with. In terms of inpatient procedures, there are a number of things, dialysis catheters that we place on patients who have renal failure, and I think we've done a very good job with that. Abscess drainages, cholecystitis, we can have less invasive treatment than cholecystectomy, where the surgeon goes in and removes it. So from an inpatient standpoint, those are some of the procedures that are kind of the big ones that we're trying to push and say, hey, we're able to actually treat that here, and we don't need to send the patient out. We
opened up by mentioning that you're Doctor of the Year. Congratulations.
Thank you.
What an honor. What does that say to you?
I mean, to be honest, it was totally unexpected. I certainly didn't expect to receive that award in my first year here. And really, what I said to Dr. Kraling when he presented it to me was that it's a privilege for me to work here. It's a great hospital. It feels like a family. So I think it's less about me and more about the hospital and the staff. They're really wonderful.
Well, speaking of family, what do you do at the end of the day to relax?
It's a little challenging. I've got 3 boys at home, 6, 8, and 10, so they're very active, very involved in sports. So, most of the time when I go home, that's my second job as dad.
Do they all play similar sports, different sports?
Two of 3 of them play hockey. 2 of 3 of them play baseball. So yeah, that's kind of where we are at this point.
You follow professional sports at all?
Yeah. But Pittsburgh, all the sports teams in Pittsburgh I'm a fan of.
Interesting draft.
Yeah, definitely. Yeah, unexpected. But
favorite book?
well, I'm a Christian, so my favorite book is the Bible.
Excellent. Music?
Boy, I'm all over the place. In terms of modern music, I like country. I grew up on a small farm, and that's the kind of music I like.
How about movie?
Oh, movie, boy. I haven't thought about that for a long time. For a long time, it was Gladiator. Okay. I think that's definitely top 3. Yeah.
Doc, we greatly appreciate your time. Fascinating learning about what you bring to Meadville Medical Center. So we thank you for coming in and joining us, and we hope you got something out of this as well. Again, you can visit Dr. Karlberg on the Meadville Medical Center website to learn more. Thank you for joining us.